Okay everyone, hi, it's Nancy Rhodes, the nurse practitioner, called Nancy the Nurse Practitioner, here for another video for you. And this one's to learn how to position someone in a hospital bed. You'd never want to leave somebody lying flat in bed like this. There's too many places on the body where bed sores or pressure points can happen. The back of the head, the elbows, the backs of the knees. I've seen them on heels and they're terrible. And also the coccyx, that little bone, the tailbone, if people get skinny enough, those are big places to break down. So we don't want to leave somebody who gets wet, who doesn't move, doesn't know to move because they don't have perception to move, or incontinent, like we mentioned. They're at the biggest risk of getting bed sores. So we're going to show you how to position my lovely assistant Denise in bed, and for no longer than 2 hours is usually the time period to leave somebody in one position. Even more often, if they're in a wheelchair, they should be up every hour and move from commode to wheelchair to bed, so people are not in one spot too long. Okay, so what we're going to do here is have Denise move over to her side. And let's say we're putting her on her left side to go to sleep at night for a few hours. So the person needs to have their knee bent a little, and they don't necessarily have to be holding onto the railing, but you're going to get your chuck ready so she's comfortable and can let go of the railing because she's going to go to sleep. But before you do that, you may have to have some pillows ready. It's really great to have a whole bunch of types of pillows, little ones, big ones, thin ones, because you don't really know where you're going to need to use them. You could even use a sheet if you don't have enough pillows, and you can actually roll them up. You could even make something called a bolster out of a bunch of pillowcases, sheets, and then just put them in a pillowcase and have a big, what's called a bolster. So what I want to show you is when you put somebody in a bed and on the side for the night, they're going to roll back over onto their hip, and then this is where the sores can happen. We want to keep them off that spot for 2 hours. Pick up your chuck and put them over the person like this. Take an average size pillow, and what you want to do is bend the pillow in half. And you want to push it up to like the middle of their back, and just stuff it underneath. And we don't want this pillow to get wet. I've got one of these slippery sheets on. So you want to put the pillow underneath the chuck and underneath the draw sheet, so that when you're ready to have the person come back over, you just have to pull out the nice dry pillow and change them and turn them around, turn them over. The other spot that's really important to think about is anything that's touching the bed. I've seen people get bed sores on the side of their heel just because their heel sat like that for too long. And you can even get a bed sore anywhere in here where legs touch. So sometimes you might want to just put a little pillow in here just to make them comfortable. And you may even want to take a bolster and put it underneath their legs to make them comfortable. Anything that keeps the pressure off the joints and the bones so they don't get bed sores or any kind of sores at all. It's really a good idea that if you see anything red or purpley looking, to not massage it, because that it's actually damaged skin, and it could be a deep tissue injury, it's called. So we don't want to rub or massage something that looks red. Okay, so that's how you would put somebody in bed on their side and position them and turn them every couple of hours. And you did it.